everyone. My topic is factors affecting compliance to anti-glaucoma medications during COVID-19 and its effect on progression. I have no financial interest. Second wave of COVID-19 hit the country during the late of March 2021, and in order to curb down the unprecedented spread of the virus and the resultant fatality, country went through recurrent lockdown and travel restrictions and mass quarantine were implemented throughout the country, hugely affecting the treatment of chronic diseases like glaucoma. Even before COVID-19 pandemic, adherence to anti-glaucoma medication has been an issue, and the pandemic had led to worsening of the situation. Aim of this study is to find those factors that affect the compliance of anti-glaucoma medications during second wave of COVID-19 pandemic and progression of the disease due to it. It was an observational cross-sectional study conducted at Tertiary Eye Care Hospital in a Cuttack district of Odisha from December 2021 to June of 2022, including patients of primary open-angle glaucoma who are on anti-glaucoma drugs more than 18 years of age, excluding the patients who are newly diagnosed cases of glaucoma, secondary glaucoma, primary angle closure glaucoma, history of glaucoma surgery, and patients who were non-compliant before the second wave of COVID. Patients were examined under two parts. The part one consists of a multidimensional questionnaire containing demographic and clinical data and questions regarding barriers for medication adherence during the pandemic. And the second part consists of examination including best character visual acuity using Snellen's chart, IOP reading with Goldman applanation tonometry, visual fields by automated perimetry for VFI, and RNFL thickness by OCT. Total number of patients examined including the fulfilling the inclusion and exclusion criteria were 220 eyes of 220 patients. Out of 220 patients, 130 patients were found to be non-compliant to anti-glaucoma medications. That is 59.09% patients were non-compliant. 143 patients belong to more than 60 year of age group, 132 were males, 58% belong to rural areas, 63% patients had to travel more than 50 kilometers from the hospital, 68% belong to lower socioeconomic status, and 78% were using more than 2 anti-glaucoma medications. The most common barrier for compliance to medications during COVID-19 pandemic in our study was found to be financial difficulties, followed by longer distance to hospital, unavailability of the transport, and non-availability of the medications as some other factors. Now, statistical analysis was done using SPSS software, and paired sample t-test was used to compare the best corrected visual acuity, intraocular pressure, RNFL thickness, and VFI before and after second wave of COVID-19, and the mean difference between all the parameters between both the groups were found to be statistically significant, that is p-value of less than 0.001. The results are shown in the slide. In our study, 59.09% patients were found to be non-compliant to anti-glaucoma medications, whereas study by Akan et al. Found a low non-compliance rate of 28.4%, whereas study by Rizwan et al. Found a higher non-compliance rate of 80.5%, whereas study by Subhadra G et al. Found a similar non-compliance rate of 57.3%. The main reason in our study for non-compliance was financial difficulties, whereas the studies by Subhadra et al., Somi et al. And Rizwan et al. Showed non-availability of the medication as the main barrier. 80.76% patients in our study had raised IOP, 24.61% has decreased RNFL thickness, and 12.30% patient had reduced VFI than pre-COVID time as an effect of non-compliance, whereas study by Somi et al. Showed 81.25% with raised IOP and 78.13% with reduced VFI. To conclude, COVID-19 pandemic has caused a statistically significant increase in the rate of non-compliance to glaucoma medication, and this non-compliance has resulted in statistically significant increase in intraocular pressure and decrease in visual acuity, RNFL thickness, and VFI compared with the pre-pandemic situation. So teleophthalmology should be the future to meet the need of glaucoma patients during the pandemic. This is the questionnaire. Thank you. Sir? Yes, sir. Sir, no, it was not control, sir. It was before the second wave of COVID-19. We take all the records from our electronic data and from the previous prescriptions. Then, according to that, the RNFL thickness of the superior, inferior, and the average thickness were compared before the COVID-19, second wave of COVID-19, and after that.
Yeah, that is the study group. Now you have shown that 40% of the cases have not progressed. You have said 60%, 59.09.
Yes, sir.
About the 40%, was the RNFL thickness the same as
So we have not,
was there a deterioration?
no,
So
so
that is what is control. So
Okay.
that is the study you must do. Like In the control group, where there was no progression, what was the RNFL variation? And where the disease has progressed, what is the difference between the RNFL progression?
Okay, sir. I had only taken the patients were non-compliant as the group, and studied.
So basically, the compliance factor was the main
Yes,
stay
sir.
of the study
Yes,
rather
sir.
than the progression, effect on progression.
Okay, sir.
Okay, thank you.
Because actually, whenever you're taking, you'll have to have a comparative study
Okay.
in this case because glaucoma itself is a progressive disease. Even with compliance, you cannot be sure whether the progression is happening or not.
Okay, ma'am.
So this study becomes a little bit biased because you're taking only non-compliant who are not on medications. Even those on medications may have progressed.
Okay, ma'am.
So that would have been a comparison. That would have given you better. Actually, think whether the medications being offered for a short period. This was only a short period. Epidemic was only there for probably maybe the exact lockdowns and everything was only for 9 months, 10
Yes, ma'am.
months.
Yes, ma'am.
So does 9 or 10 months of not giving medications does it actually cause harm? And then maybe you could have categorized your patients into the stages of glaucoma, as mild, moderate, and severe. Because
Okay,
every
ma'am.
stage would not advance so much.
What I suggest is you have got a good data. You have an excellent database. 220 patient study is very good. Go back and do this study.
Okay, okay, sir.
You
Thank you.
have the data. You have to just interpret it.
Okay, sir. Thank you, sir.